Okay, let's get started. My name is Bill Patchane. I'm the Executive Director for the APDA of Massachusetts. Welcome to today's presentation, Preparing for a Visit with the Neurologist. We want to thank Dr. Bird today for today's presentation. She's at Boston University Medical Center. She's going to lead today's presentation so that everybody knows it's a webinar. So if you have a question, there is a tab at the very bottom for questions and answers. We've allotted some time at the very end for us to take questions and have Dr. Bird answer those questions. So thanks very much for joining. So if you can move to the next slide, please. So again, my name is Bill Patchane. I'm the Executive Director for the American Parkinson's Disease Association Mass Chapter, and welcome to today's presentation. The APDA of Massachusetts has been in operation for decades and offers programs and services to the PD community in Massachusetts and surrounding states. We've received a very large response to today's presentation. As you may know, there's been a tremendous amount of progress in understanding and treating Parkinson's disease. PD is highly individualized from person to person. Not all that is discussed today is relevant to everyone. The healthcare team must be familiar with signs, symptoms, treatment strategies, and how those impact the individual patient. Treating Parkinson's disease well requires a team approach. And so today we are providing information that is not intended as medical advice. So I'd like to welcome today's presenter, Dr. Katelyn Bird, MD. She's the Assistant Professor of Neurology at BU Medical Center in Boston. Dr. Katelyn Bird is a board-certified neurologist and movement disorder specialist at Boston University Medical Center. She obtained her undergraduate degree in biological sciences with a neuroscience specialization at the University of Chicago before completing her Doctor of Medicine at Indiana University School of Medicine. She completed her internship and neurology residency at Boston Medical Center, serving as the chief resident in her final year. Dr. Bird graduated from fellowship in 2020 and is a movement disorder attending doctor. She specializes in the diagnosis and management of individuals who have PD, atypical Parkinson's disease, tremor, Huntington's disease, dystonia, ataxia, and other movement disorders. She is experienced in deep brain stimulation for movement disorders, including patient selection, evaluation, and post-operative programming. She is also skilled in the use of Botox injections for movement disorders and migraine problems. We'd like to welcome and thank Dr. Bird, and what I'd like to do is turn it over to Dr. Bird for today's presentation. Thank you.
Great. Thank you so much, Bill, for that kind introduction. And thank you so much for the APDA for hosting this wonderful webinar series. Just to refresh, this will be a webinar type event. So if you have any questions that come up while I'm speaking, please enter it into the Q&A box on your screen, and we will do our best to address as many of your questions at the end of the session as possible. So this session is all about helping your neurologist to help you. So we're going to break it down into 3 easy steps. What can you do before your appointment to help prepare? What can you do during your appointment to make the most out of the time that you have with your neurologist? And what should you be doing afterwards? Help keep those lines of communication open with your neurologist. Again, help me help you. So we'll start off before your appointment. It's important to understand who you're going to be meeting with, because the kinds of questions that you might be able to have answered vary depending on who you're meeting with. Are you meeting with your primary care doctor? This might be a good opportunity to raise concerns about specific neurologic symptoms that you're experiencing. They might be able to help with a referral to other specialists. Are you meeting with a neurologist? This is a kind of doctor who has done 4 years of training after medical school to become a neurologist. Some neurologists are highly versed in the treatment of Parkinson's disease, but not everybody who graduates from neurologic residency has a movement disorders specialty interest. It's important to understand, is your neurologist a general neurologist, or is your neurologist a movement disorders specialist? Movement disorders specialists are neurologists who have completed 1 or 2 additional years of training in movement disorders specifically. What should you be bringing with you to your appointment? Well, if it's the first time that you're meeting with your neurologist or your movement disorders specialist, it's important to speak with the front office ahead of time to ensure that they've received a copy of your medical record. This helps you and your neurologist hit the ground running. Your medical records will include things like office notes, MRI, CT imaging reports that you've had done, including the disc with the actual images on them, and lab reports. What else should you prepare ahead of your appointment to bring with you? Well, it's very helpful if you bring an updated medication list that includes the timing, the dosage, and when you started each of your medications. I'll speak for myself. If you come in and tell me you're taking that orange pill, I have no idea what pill that is. So look at the names on the bottles and the milligram amount, the dosages that you're taking, and write out for me exactly what you're taking and when. You want to include all of your Parkinson's disease medications, of course, but it's also important for your movement disorders doctor to know all the other medications that you're taking to monitor for any potential interactions. It's also important to list over-the-counter medications that you're taking and any vitamins or supplements that you're taking on your own. This is also crucially important. Bring in a list of medications that you've tried before, but they were discontinued for some reason. Were they stopped because they weren't beneficial? Were they stopped because you had side effects? This can help save time with your neurologist to make sure that we're not giving you medications that you've already tried before and had bad effects. What else should you bring with you? You should bring a list of all the symptoms that you've been experiencing from your Parkinson's disease. This will include your motor symptoms. So a diary of how your speed has been, how your mobility has been, any challenges, problems with increasing tremor. Is there a certain time of day where you find your symptoms to be the most bothersome? Are there certain times of day when you feel your symptoms are under good control? Let your neurologist know if you've been experiencing any dyskinesias. And for those of you who might be unfamiliar with the term dyskinesia, dyskinesia is a type of involuntary movement. I describe it as being a little bit wiggling, a little bit dancing. It can happen in any part of your body, but is often a side effect from medications. You might look like this lady over here. Have you been experiencing dyskinesias? If so, when? Is there a relationship to the timing of your Parkinson's medication? Then have you been experiencing any fluctuations in your motor symptoms? By this, I mean, are there periods of time where you feel really slow and stiff, or your tremor comes back, and it flip-flops back and forth between having too much movement and having not enough movement? Are there times where you feel more on, times when you feel more off? Any patterns to when you're taking your medication? If you've done some of this thinking ahead of time, it can really help your neurologist to make adjustments. I also want you to think about non-motor symptoms that you've been experiencing. The motor symptoms in Parkinson's disease seem to get all the press, but the non-motor symptoms are just as likely, if not more, to affect quality of life. Often these symptoms are underappreciated by patients and physicians alike. So you'll be your best advocate if you have a list of these symptoms ahead of time. How is your swallowing function then? How is your speech? Any nausea, problems with constipation or urinary difficulties? This can include frequency or urgency. Any problems with drooling? Any changes in your thinking or memory? Parkinson's is a multi-system disease that can affect all parts of your body. So if something doesn't feel right or feels off, it's important to write that down and bring those symptoms with you to the neurologist so that they can make adjustments if needed. This picture just shows some of the many non-motor symptoms that can happen in Parkinson's disease, but it's not a comprehensive list. The most important thing to bring with you to your appointment is a list of high priority items. So your time with the neurologist is limited to such a degree that both your neurologist and you might not feel like you had enough time. So it's important to set that agenda right at the beginning. So think about 2 or 3 things that you really want to talk about. 2 or 3 things that you'd really like to have covered during the meeting. Make sure that your neurologist knows about these items early, almost before the appointment starts. These items can be anything from medication side effects, adjustments, or symptoms that you've been experiencing. So, just to summarize, before your appointment, you should bring with you your medical records if your neurologist does not have them already. If your neurologist does have them, bring in any interval records from a hospitalization or images that you might have had since you saw them last. You want to bring a list of your current medications and a list of your previously tried medications, including side effects that you might have experienced. Bring a list of your Parkinson's symptoms, both your motor and non-motor symptoms. And finally, have those top 2 to 3 items that you would really like to discuss. So let's move on to your appointment. The day is here. First things first, arrive early. You want to make sure that you're leaving plenty of time for city traffic, parking, getting yourself comfortable, using the facilities, finding where you're going, check-in procedure, filling out any paperwork. You want to make sure that you're not feeling rushed. A sudden off episode on your way in can ruin an entire appointment. So plan ahead. Keep in mind that that allotted time that you're given is a lot shorter than probably you or your neurologist would like. So you want to make sure that you are taking advantage of all the time you're given. So arrive early to avoid any strict late show policies that might preclude you from having your appointment at all. Bring a friend with you and some snacks. It can be really hard to remember everything that's discussed during a neurology visit. Having a family member or a friend with you to help take notes and serve as a second set of ears can be crucially helpful. I mentioned that you want to arrive early. Your wait time could be pretty variable. So make sure you have water with you. Make sure you have snacks. And most importantly, always have an extra dose of your Parkinson's medications on hand. Hopefully appointments aren't running hours behind schedule, but you never know. You never want to be caught without your next dose of medications. Use those notes that you brought with you. You took all these beautiful notes before you came in then. Use them. Talk about your medications. Talk about your symptoms. Make sure your neurologist has a clear understanding of what medications you're taking, when you're taking them, and the constellation of symptoms that you're experiencing. You'd get bonus points from me if you can actually come in with a list and hand it to me with all of your medications spelled out on it. This is your time to make sure that you're covering those 2 or 3 absolutely can't miss topics in your conversation. Other things that you should be asking for during your appointment. Ask for refills. Ask for referrals. Physical therapy and occupational therapy are essential in Parkinson's disease. We know that there currently are no medications that slow down or delay the progression of Parkinson's disease, but exercise and regular physical activity can. For many people, jump-starting physical therapy and exercise is challenging. Physical therapy can help give you that kind of kick to get started. They can also show you exercises that are safe to do at home, safe to do on your own. I like to think of physical therapy and occupational therapy in Parkinson's disease as being like dentist appointments. Check in every 6 months or so for a tune-up, just to make sure that things are constantly on the right track. So if it's been a little while since you've participated, ask your neurologist for an updated referral. There are options for physical therapy in the community, and there may also be options for them to come into the home so that transportation is even easier for you. Are you experiencing problems with quiet voice? Are you experiencing problems with coughing while swallowing foods or liquids? Consider asking for a referral to the speech-language pathologist. These individuals can help you improve your swallowing function or make recommendations about the kinds of foods or liquids that you should be swallowing. There are also specialty programs to help improve the volume of your voice. Your local neurologist will know how to connect you with these programs. Ask your neurologist about any recommendations for exercise and nutrition. I mentioned that exercise is crucially important, but it's often hard for people to get going. The APDA has some wonderful resources for exercise programs, both online and in your area. Ask your neurologist if they have any recommendations about nutrition as well. This is also your opportunity to ask for medication refills. So keep a tally of how many refills that you have outstanding and make sure you get things refilled while you're there in person. I also added ask for a televisit follow-up to this list. So for some people, transportation into the city to see their neurologist or movement disorder specialist can be challenging. There's the traffic involved, the transportation time. For some people, it's much more comfortable to do their visits in their own home through a televisit, similar to this on the computer screen, where you can talk with your neurologist in live time. Not all neurologists have televisit capabilities, but if that's something that would appeal to you or would make your life easier, I recommend asking as to whether that might be an option for follow-up appointments. Medication changes, check-ins on symptoms, most of this can be done remotely through a televisit and doesn't necessarily need an in-person visit. When you have your neurologist's ear, this is also a wonderful opportunity to ask about clinical trials. Not everybody is interested in clinical trials for testing out new medicine therapy, new exercise therapy, but some people are, and this is the opportunity to ask your questions. How do you find out about these trials in the first place? Well, speaking with your neurologist is an easy way, but I also encourage you to consider joining the mailing list for your local movement disorder center. Most movement disorder centers send out regular email or paper mailings, with updated clinical trial information. So they would be happy to keep you abreast of what is happening. I also encourage you to check out Fox Trial Finder. So this is part of the Michael J. Fox website. You type in your zip code and they'll tell you all the clinical trials that are available in your area. There are also two other fantastic resources for knowing what's out there. The first is clinicaltrials.gov. It's a little less user-friendly than some of the other sites, but it's probably the most comprehensive. And it lists the Parkinson's trials that are ongoing, that are recruiting, and that you could potentially be a candidate for. The other wonderful website is the APDA.ma.org website, which also keeps a list of active trials. Keep in mind that trials don't necessarily mean taking a medication. Some trials are strictly observational, and they ask you to fill out surveys every so often. Check out these websites frequently, as trials do change over time. And even if you're not a candidate for a trial now, you may be in the near future. So to summarize your goals for your appointment, get there early. Make sure you have time to breathe, attend to your bodily needs, check in, and get the most out of your appointment. You don't want to be stressed trying to find parking and miss your appointment. Early is best. Bring a friend with you. Bring that family member. Bring somebody who can serve as a second set of ears. Somebody who can write notes for you, take things down. Somebody who can advocate for you. Someone who can help remind you about those top 2 or 3 priority items that you definitely want to discuss. Don't forget your notes. You brought them with you. Take advantage of them. Bonus points if you've printed them out and given them to your neurologist. Don't forget to ask for referrals and refills, things like physical therapy, occupational therapy, speech, as well as your medications. And finally, if you're someone who's interested in participating in clinical trials, ask about them. All right. What can you do after your appointment? What should we be doing then? Well, stay in touch with your neurologist. I don't go home with you. I don't know whether you're taking your meds, not, if you're having side effects. You don't want to wait until that follow-up appointment that might be 3, 4, 6 months in the future. You want to stay in touch. How? Well, my chart is a great way to do that for those of you who have neurologists that use Epic. Epic is one of our electronic medical records, and my chart is a way of sending messages directly to your neurologist. You can also see the notes that were written. You can see the images and copies of the reports, copy of any lab tests that has been ordered. It increases transparency in your medical care. There's also an option for sending a message directly to your care team where they can help triage and make adjustments to your medications even before your next follow-up appointment. Even if your neurologist is not on Epic, there are often other patient portal options to keep those lines of communication open. Word of warning, these patient portals should not be used for emergencies. So if something is happening urgently, you're concerned, there's an increase in falls or increase in hallucinations or something that's dramatically out of the normal, call the office. My chart and other patient portals generally have a turnaround time of about 48 hours. So if you can't wait that long, you are better off calling your neurologist directly. If you're having a hard time connecting, don't forget that the emergency room is always open and can get in contact with your neurologist if necessary. Finally, we want to make sure that you keep learning and you get involved. The American Parkinson's Disease Association is a wonderful resource. They have a fantastic website I'm in Massachusetts, so I'm a little bit biased towards our Massachusetts group, but they have wonderful sites wherever you might be located. There are referral information and referral centers nationwide that you'll be able to find on the website. This is the phone number for our information and referral center here in Massachusetts. And this is our email address. And here's the website. So just to summarize, what should you be doing after your appointment? Well, you're going to keep those lines of communication open. You're going to communicate with your neurologist. Let them know how those medication changes have helped or maybe not. And you're going to figure out how you can get involved more, learn more. Check out the APDA website. So, just to summarize everything we talked about to prepare and make the most out of your visit with the neurologist. Before your appointment, you're going to make sure that they have a copy of your medical records. This is everything that has happened since they saw you last. You're going to bring a list of your medications, dosing, and side effects, not just the colors of the pills. Give me the actual names. You're going to bring a list of your active Parkinson symptoms, both motor and non-motor, that you would like for your neurologist to address during the visit. And you're going to have those top 2 to 3 priority items that you would like to discuss. During your appointment, you're going to get there nice and early. You're going to bring a friend or a family member, and that includes an extra dose of your Parkinson's medications. You're going to use your notebook to make sure that we're covering those priority items with bonus points for bringing a list of your medications for your neurologist. You're going to ask for referrals and refills. And you're going to ask about clinical trials if you have any interest in participating. Finally, after your visit, you're going to keep the lines of communication open through your patient portal, and you're going to check out more about your disease and learn how to get involved. I recommend the APDA website. So with that, I would like to thank you all for joining our webinar. I wanted to leave tons of time for questions. So I think I did my job. And so we got plenty of time to answer any questions if anything was unclear. This here is our group over at Boston University Medical Center. We have 2 locations where we're currently seeing patients with Parkinson's disease, both in Boston and in Weymouth. So with that, I will turn it over to Bill to see if any questions came through.
Yes, absolutely. Thank you, Dr. Bird. Great job today. And so I want to encourage, if anybody has any questions, please type those questions. There's a Q&A button at the very bottom of Zoom. Send us the questions and we'll try to get to as many as we can. We have a few questions, so I'd like to ask Dr. Bird these questions. How often can a person with Parkinson's disease be seen in a year? I feel like my visits are a little far apart.
Yeah, so this is very site dependent. So in my practice, if we're making a lot of medication adjustments, if things are being titrated frequently, if we're still trying to kind of figure out a good regimen for somebody, I do like to see them every 2 or 3 months while we're actively making changes and making adjustments. Now, I also have a cohort of patients who are incredibly stable. They've been on the same dose of medications for a long time. Coming into the office or having a visit is difficult with their lifestyle. They might still be working. So for those patients, I tend to see them once or twice a year. Maybe I'm seeing them primarily through televisits. Maybe we're primarily communicating via MyChart. It's very person dependent, but I would say most frequently, I don't see people more frequently than every 2 or 3 months for routine Parkinson's follow-up.
Good. Thank you. The next question we have, if I have trouble using the My Chart, who is the best person to ask for help with this?
That is a great question. So I think the first part is making sure you're signed up for it. So there's a lot of people who haven't signed up for it. They don't have that activation email. So what I'll actually do is I'll take the time during my visit to make sure that we've sent you the link via email so that you have access to My Chart. For some of my patients, they've forgotten their password. Understandable. I do that all the time. There is a way for me as your provider to reset your password during your visit. So we can make sure that your kind of visit, that at least you can log in. After that, if you're having problems navigating the platform itself, I encourage you to play around with it a little bit. Just like any new technology, it can take a little while to get used to it and figure out where things are located. Sometimes a younger family member, like a child or even a grandchild, can help you find things on the My Chart. If that's not available to you, the different hospital systems do have a My Chart person who should be able to answer your questions for you and help you learn how to navigate. They might have a handout or somebody who could sit down and show you how it works.
Good, thank you. Next question that I have is, what is the best way to make sure my primary care physician gets a note about my visit with the neurologist?
That is a great question. So if your primary care doctor and your neurologist are within the same hospital system, if they use the same medical record, those notes are sent automatically, no issue. Your primary care doctor can read through. That's not often the case. And so I do advocate for you bringing a fax number for your primary care doctor with you to your neurologist's office. Then what I do at the end of my note is I say, please send a copy to the primary care doctor. I forward it over to my support people, and they're able to make sure that the notes are forwarded on.
Great. Next question I have is, I'm changing neurologists. Can I request that my records be sent to the new neurologist?
Absolutely. So there's a few different ways to go about making sure records are switched. So again, if it's within the same hospital system, they should be able to see your records. If it's within a different hospital system, you will need to do a little bit more manpower. There's a couple ways to go about this. The first way is kind of trusting the system and seeing if they'll transfer it for you. I wouldn't necessarily rely on that. Instead, what I would recommend doing and what I would probably do is call up medical records yourself and ask for a copy of your personal medical records. Ask them to burn a copy of your images to a disk and then kind of physically bring that to the new neurologist's office.
Good, thank you. Next question I have is, who should be the captain of a PD patient's team? The general practitioner or the neurologist, or should it be me?
Ooh, that is a fantastic question. I love that so much. So I think ultimately, we don't go home with you. You're the one who's in charge of your body. You're the one who's taking the medications or not taking the medications. You're the one who's doing the exercise or not doing the exercise. So no matter what recommendations I make or your primary care doctor makes, it only goes so far as you are willing to participate and work with us. So I think the patient and the patient's family really are at the center of everything that's happening. As a movement disorders doc, I see my role as somebody who makes sure that you are achieving the things and goals that you want to achieve. So my job is to make sure that from a Parkinson standpoint, that we have you on the right medications, that we have you hooked in with all the referrals that are needed, that we make sure that you're maintaining that good, healthy exercise and diet. But I'm probably not monitoring things like your diabetes or your high cholesterol or your blood pressure necessarily. So it is important to have both that movement disorders doctor and that primary care doctor who are working together to take care of you. At the end of the day, though, you are your best advocate. Your family is your best advocate. And I think you need to know kind of the kinds of care that you're taking. You need to know the names of the medications you're taking because it affects you and you're the one who's in the middle. So I think of it more as kind of like a circle, but I would say you're in charge.
Good, thank you. Next question we actually get quite frequently. Any tips for soft speaking voice that only happens sometimes? What do you think about choral singing?
Love choral singing. Love, love, love. That's one of the wonderful activities that are available on the APDA website and can help kind of hook you in with local groups. But I think singing is wonderful. It works on kind of breath control as well as kind of phonation and kind of dynamics. So I think choral singing is a wonderful exercise. I also think that, singing's not for everyone. And so our speech therapy colleagues do have wonderful exercises to work on projection.
Good. Next question is there a recommendation that you might have regarding alternating between in-person visits and virtual visits, especially for a person that is having trouble with transportation?
Yeah, so I would say for the vast majority of people, that very first visit should be in person. As a neurologist, I like to know how fast you are, how your tone is, how your walking is, if you're experiencing any postural instability. And those are things that I really just can't capture well through a video screen. That first visit helps me to make sure that I have the proper diagnosis for you, and it really helps set us off in the future on a plan for maintenance. I would say that at least once per year, we should probably aim for an in-person appointment. Same idea, making sure that we're getting that good baseline physical exam, making sure that we continue to have the right diagnosis for you, making sure documenting any changes. Other than that, I would say kind of over the course of the year, I think having virtual visits to supplement is a great option for people, especially if transportation is an issue, because they don't need to come into the office. It's really going to be neurologist dependent based on whether they have that option for you, but I think it's definitely worth exploring and asking for with a plan to maybe see your neurologist in person once every year or 18 months, once things are stable-ish.
Good. So thank you. That's all of the questions that we have for today. So I want to thank Dr. Bird for a great presentation today. As a follow-up, our plan is that we'll be sending out information on this presentation via a link to YouTube. And so you should be receiving that email over the course of the next week or so. So thank you so much. If you can move to the next slide, please.
Absolutely.
Thank you. So again, information referral here at the INR Center at BU Medical Campus. Phone number 617-638-8466. We do referrals and resources. We have a great staff there with Rosemary Owen and Kathy Thomas and all of the neurologists there. If you haven't engaged with your local APDA chapter, please reach out to them. I'll also be sending a link for you to be able to navigate to your local chapter. APDA provides education and support. We have got education virtually and also in person. We provide support groups in many areas across the country. We also do symposiums and educational events. Health and wellness, we provide exercise and movement classes, not only in person, but also virtually. We have fitness professionals training program that's available online if you know anybody that might be interested. And here in the Boston area at BU Sargent College, we have the APDA National Rehabilitation Resource Center. That's an option for you to call if you have any fitness or exercise or PT questions. Thank you. Next slide, please. Again, thank you so much for attending today's presentation. If you haven't already, make sure that you connect with us on Twitter And the address for the Mass chapter is there, as well as Facebook, Instagram, and on our website. We provide great grassroots connections to the community and the areas that we operate in, and we love to stay connected with you. So again, I want to thank Dr. Bird for a great presentation today. Hopefully everybody walked away with great information. We were able to get through the majority of the questions. And so thank you, Dr. Bird, and the staff at the APDA Information Referral Center. Great job today, and thank you so much.
Thanks for having me.